So I've chosen to support StoBox and to bring my clinical and medical experience in the world of infection to this, really because I see a need for it. So we all have first aid boxes at home, but they're all a little bit reactive. You stub your toe, you get a fever and you need something there. But in my world, in the world of infection, the best possible answer is to stop you getting an infection in the first place. And with StoBox, what we're trying to do is exactly that. We're trying to introduce good quality bits of kit into your life when you need it so that you can minimize the risk of transmitting infection onwards, or if you have to be in a situation where you are at risk of getting infection from others, we can minimize that risk as much as possible. And the StoBox has all the kinds of kit that you need to be able to do that. So the StoBox has protective materials that are perhaps useful for businesses and for consumers kind of alike. So consumers like you or I are going to be exposed in our normal daily life to situations where there can be spread of infections between us, just because we have to go shopping, because we have to go to work in some circumstances. And the StoBox contains materials that are going to help us minimize the risk of infections. Similarly for businesses, where some businesses do have to continue, you do have to have your employees in the workplace, and some of them may develop illness during the course of their working day. And at that point, when those individuals become aware of themselves feeling unwell or having a fever, they can use the materials in the StoBox to notice they have a temperature. And then they can use the materials in the StoBox to minimize their risk of transmitting that infection, bug, onwards to their colleagues in the workplace and decontaminate their area afterwards. So it really is a dual product for ourselves and home, and for businesses where we sometimes have to go into work. So in the StoBox, there's a lot of different materials, and I like to talk about them in a couple of different ways. So one of them is the alcohol gel and the alcohol wipes and the disinfectant wipes, and they're really there to limit the direct transmission of infectious organisms, bugs, from our hands and from the immediate environment around us, computer keyboards, mobile phones, things like that. And the alcohol content in these alcohol gels, wipes, is really key in its ability to kill certain types of bacteria and viruses. In doing that, you can then get on with your life. You can then use your hands as you would, decontaminating them, use your keyboard, use your phone in a normal way, being reasonably assured that you've minimized the risk of there being bugs and organisms on it. The StoBox also includes masks of a couple of different types that will reduce the chance of you breathing in, or perhaps more importantly, coughing out onto your colleagues, those around you in the society in which we're living, and spreading those organisms through a respiratory route. So the StoBox has got things kind of coming and going. So I live and breathe communicable diseases which we transmit to each other just as human citizens on this planet. And really one of the key things that I would love to be able to say is that any behavior change which we adopt as citizens can make my life easier and make the health of the globe better, to be honest. The contents of the StoBox help us do that by minimizing the risk of us transmitting organisms, of bugs, bacteria, viruses to each other, either directly from the respiratory tract or in the things we touch every day with our hands, in our workplaces, in our homes. It's a little bit sad to say, but anecdotally, across particularly the last 8 weeks, but in the 15 years of my infection practice, there are substandard products out there. And some of my work has been revolving around trying to optimize products, in whatever field of infection they are, so that the consumer or the person with the prescription or the person who's trying to seek medical advice for those infectious diseases gets a quality product. Now in the StoBox we have medically curated materials, products in there that we've sourced to meet the required European and global standards for those bits of kit. And in doing so, what we're hoping that we're going to put there is a functional group of equipment that's really going to help you minimize the risk of transmission of bacteria and viruses and bugs, basically, between ourselves in our daily lives, in our work lives. So preparedness and protection are essential when it comes to mitigating against infectious diseases. So really what my ultimate goal is for me to be out of a job. Because if we can do that by being prepared and having the required materials to minimize the risk of transmission of bugs and viruses between ourselves, then that won't be a part of human ill health. And then we can concentrate our global science on other things that we can't transmit to each other, cancer and all of the other problems of our day and age. But really, infectious disease is something we can all work together to overcome. And the StoBox is part of that equation, along with the way we adjust our behavior, the way in which we interact with each other, and of course the way in which we can help as a society to get us over this hump, but also over infectious diseases or work towards the end of infectious diseases as a whole. The impact of infectious diseases, bugs, germs on society has kind of shaped the way in which we function as a global society, the way in which we have moved our populations over the last hundreds, thousands, millions of years has been influenced by the risk of infectious diseases. I mean, one of the big things was the Black Death, right? So they do change the way in which we as humans interact with each other as a social level. But really what we need to do in this day and age of fast travel, of the ability to fly around the globe in less than a day, what we need to do then is change the way in which we as humans are coping with that change in global behavior. And the StoBox helps with that by enabling us to minimize the risk of transmission of bacteria between ourselves, and the contents in there allow us to have a normal social interaction whilst minimizing that risk of transmission of infection. So I think there are 101 things that society can learn from the 2019 coronavirus outbreak. I think perhaps first among them is that things like this are beatable. We as a society across the globe have come together, have listened to the scientific basis for combating this disease, have listened to the restrictions it has on our society, on our lives, on our economy. But what we've done is to go with that, but also to go with the changing evidence as the evidence evolves. And that's been one of the most difficult things about the last 8 weeks, 12 weeks, 16 weeks, is how as the science has evolved, our messages to citizens, our global citizens, has changed, and how sometimes we have had to change our mind and go back, and that can knock confidence, but it has to happen. But I think what we can learn as a society going forward is that there is a reason to have scientific basis for all the decisions we make, scientific basis to society's decisions, scientific basis to the bits of kit we are using to minimize the risk of infection transmission between ourselves, and how we need to have that embedded in our global society. From this current outbreak, I have personally learnt about the resilience of our society, and how that when we work together, we can overcome things like this. The medical side of it is an evolving process. We've learned a lot about how to combat this virus in hospitals, but actually what's most inspiring, what I've taken away from this, is that when we work together as a society, we can overcome things like this. What I've seen during this outbreak that's given me hope for the future is the resilience of all of our citizens, the people who are coming into my hospital, the people who are staying at home and not coming into my hospital, the key workers who are out there putting themselves at risk. Everybody has worked together to help us get through this. And really seeing that raw humanity amongst our citizens has really given me great hope for our British citizens, but for the global society. So I am optimistic moving forwards.